Hello, I'm Dr. Kant Shah, Pediatric Surgeon, and today I'm going to talk about a topic which sounds very technical but is actually very reassuring once you understand it, and that is robotic surgery in children. To begin with, when parents hear robotic surgery, the first reaction is of fear. The natural thought is, does robotic surgery mean that a machine is going to operate on my child? The simple answer is no. The robot never works on its own. It is always the surgeon, like me, who is fully in control of every single movement of the robot. The robot is simply a very advanced tool which helps us operate with more accuracy, precision, and safety. So why is this important? In the past, children born with serious surgical conditions or birth defects had to fight simply to survive. Advances in surgery and anesthesia changed that. Today, most children not only survive, but they go on to live full, healthy adult lives. But some complex problems still require very major surgeries in children, sometimes with large cuts, prolonged recovery time, and a significant amount of pain. And this is where modern technologies such as 3D laparoscopy and robotics is helping us take the next big step. Today, we are not only saving lives and improving recovery, but reducing the pain and helping children return to normal life much faster. In simple terms, robotic surgery is an advanced form of laparoscopic or keyhole surgery. Instead of holding the instruments directly in our hands, we sit on a console and control the robotic instruments ourselves. These robotic instruments copy my hand movements inside a body cavity such as abdomen or thorax or the chest cavity with more steadiness and finer control. Also, there is a 3D high definition camera which gives me a very magnified view, almost like a microscope operating on a small organ of a child. These robotic arms mimic my hand movements only with greater steadiness and finer control, while a 3D high definition camera gives me a very magnified view inside the body cavities. So this technology brings about three main advantages. One is greater precision. The robotic arms can move with a lot of accuracy even in very tiny spaces inside a child's abdomen or chest, which is very crucial when we are operating on a child because there is not enough space. Second is the 3D visualization. Such magnified 3D visualization is actually like looking under a microscope, which allows us to look at small structures and operate or reconstruct them. In addition, robotic surgery reduces the surgeon fatigue. Because I am operating from a console, I can sit and operate and focus on the surgery better, and less tiredness and fatigue means I can do more complex focused surgeries for longer. So which surgeries in children is robotic surgery suitable for? Not every surgery in a child needs robotic surgery or can be done by robotic surgery. Simple operations like an appendix or very large tumors are usually not suitable for robotics. But today, robotics can be applied to almost 70 to 80% of what we do as a pediatric surgeon. The main advantages are in kidney surgeries, where we do complex reconstructive work like pyeloplasty for a PUJ obstruction, or we do keyhole surgery inside the bladder of a child where we do a ureteric reimplantation. When we have to reconstruct the last part of the large intestine for Hirschsprung's disease like Duhamel's procedure, when we have to do intestinal surgery or complex bladder surgeries, when we have to operate on the lungs or the food pipe inside the chest. In all these procedures, usually there is a lot of work to be done and the space is very little. And hence the robot really adds a lot of advantage to me as a surgeon and to the child. It definitely has less scars, less pain, less hospital stay, but also a quicker return to school and to play. And it also allows us to do surgeries which would be too complex to be done by even laparoscopy. So it expands the horizon of what we can offer to children as a surgical option. If I can share an example, recently we operated on a 4-year-old baby who had a blockage in the pipe of the kidney where the urine flows down from the kidney towards the bladder. It is called a pelvic-ureteric junction obstruction, and this requires putting around 10 to 15 stitches on each side of a 2 centimeter small ureter. This is very fine work. And this precision is far easier with a robotic surgery than open surgery. Traditionally, this would be done with an open incision, which would be around 3 to 4 inches long. We were able to do it with tiny cuts of around 8 millimeters. The child recovered very quickly and by 1 week was able to go back to school, and by a month's time was able to do complete normal sports and all other kinds of exercises. It was not just a big relief for the parents, for also me as a proof that this technology is here to stay and to help children in the very long run. So when you think of robotic surgery, please don't think of a machine taking over. Picture it as a surgeon using the most advanced tools to do very fine, precise, accurate surgery, which is very safe for a child, to not just help them survive or overcome that problem, but allow a very healthy, normal, long-term life. I hope this video has cleared some doubts for you. In future, I would speak a little more about specific robotic surgeries. Please stay tuned, like and subscribe our channel. And if you have any comments or fears still, then please write them down in our comments. Thank you.